Well, I actually was incredibly enthusiastic about it.
Yeah.
I thought that this was a landmark moment for us.
So in terms of first-line HER2 positive metastatic disease, we've been doing the same thing for a long time, for more than a decade.
Yeah.
The Cleopatra regimen. What's your experience been like with that? And are you satisfied with that? Or is it finally time to see the death of Cleopatra and move on to something more cutting edge?
Well, I will say, of all of the spaces where we have been comfortable, it has been this Cleopatra space. Mm-hmm. After you get a patient through the first few months of systemic chemotherapy, patients can have very long time, excellent quality of life, sometimes. And then we had some gaps to fill. We had central nervous system gaps to fill. We had improved efficacy gaps in patients who presented with heavy visceral and symptomatic burden. So definitely needed improvement, and we definitely are seeing that here. But I will say that the experience during these years with the Cleopatra regimen has allowed us to learn a few things. And one of those things is how lovely it is to preserve quality of life during a maintenance period.
Sure.
Yeah.
Of course. What was your maintenance in, let's say, the hormone receptor positive subset of HER2 positive first-line metastatic? Were you layering it along with the dual antibodies? Were you layering in endocrine therapy?
I did. I think, early on, I think perhaps not, because the trial originally, did not do that. But ultimately, for the majority of the time, yes.
So last year at San Antonio, we saw a presentation of the Patina trial, which was not only an endocrine therapy and dual antibody maintenance, but also layering in a CDK4/6 inhibitor. What are your thoughts about that?
Well, I actually was incredibly enthusiastic about it.
Yeah.
I thought that this was a landmark moment for us, and a resurgence of palbo. However, still not published, still not in guidelines.
Right.
However, I will say, with the benefits seen in the trial, which was a substantial prolongation of progression-free survival, I have used that regimen.
You have?
I have. And
interesting.
Yeah. So the drug is incredibly well tolerated, palbociclib. So it's quality of life not really impaired. There's certainly a cost issue.
Right. But, and in your jurisdiction, no issues with payer coverage?
No, it's a small N, an N less than 5, but no.
And then in 2027, palbociclib becomes generic.
Yeah.
So presumably the price will drop substantially. So that could be a refreshing new paradigm for a selected patient, perhaps.
Agree.
It's really interesting. You've already been using it. That's really provocative. Now, I assume the reason we haven't seen regulatory filings and publication yet is because it was late breaking last year at San Antonio. I think they got everything in line for a late-breaking presentation like the night before the meeting or something, literally. So I think it takes a while after such a rush to get those things moving.
I think you're right. I do remember, there's a small piece of me that harkens back to the TCH versus AC to TH era where we went years before publication and at some points got quite nervous about why.